All right. Well, welcome back, Dr. LaValle. This topic we're going to talk about today is something so important that there's a lot of confusion, not only in the general community, but the medical community about what is this long haul COVID or COVID long haulers, and what does it look like? What does it mean? And we've been sharing stories, before we went live, obviously, and one about your son, which I really want you to tell that story because it's really pretty profound. And then other stories that we were talking about with diabetes and heart issues and heart palpitations, and even just general vague things like fatigue, unexplained symptoms. And it's really important because what it seems like is this is such a big thing that's happening, and so many clinicians don't know what to do with it or how to manage it. So let's just start with what does long COVID mean, or COVID long hauler? What does that even mean?
Well, I mean, basically you got a COVID infection, maybe once, twice, 3 times, right? You have people that have gotten it multiple times.
Whether you knew of it or not, whether it was mild or severe, it doesn't matter.
Yeah,
okay.
But you got through it, and then either immediately after or sometime down the road, some issues start to pop up. And they pop up because there's this lingering inflammatory chemistry, and if you look at the literature, mitochondrial, or basically the components of your body that are making energy in every cell in your body, the mitochondria, the powerhouses of your cell, are disrupted. They get unplugged. You don't make energy. And now that creates an opportunity for all sorts of complications. So when you hear COVID long haul, it's really the inability to recover from infection, and then the subsequent symptoms, which you just mentioned it's all over the map in terms of what people are experiencing. And, I think it takes an understanding of just saying, well, where does it start? Why does it trigger such a response? And then more importantly, how are we going to help people to feel better to overcome that? Because a lot of people out there that are suffering from it. I mean, I think you mentioned it before we, got on our talk today of, it's almost like it's a specialty now.
100%.
That
with no education behind it.
Everybody's just kind of throwing stuff at it, going, I hope this helps. Right. And so I think it's really important that, we just start to have the discussion.
Absolutely. Well, and this has become a specialty area for you that you really are treating a lot of. So you being an expert really in this space is really amazing. And there's another misnomer that a lot of people think it's just the kind of unhealthier people that are getting this. But, we've talked about before we started 2 totally different people. One of my patients who's not a super healthy, he's a smoker, and, he had this random fever for a month, couldn't figure it out. He got sick. He was also vaccinated, but he also got sick. And then, that was a couple of years ago. And now there's this unexplained fever. What's going on? You helped me with his case. We ran every test. His liver enzymes were elevated. What's that about? We ran all the hepatitis panels. Nothing came back on that. But his cytomegalovirus, so CMV and EBV titers were really high. So we looked at all these antibodies trying to find a reason. And we finally drilled down that he had a recurrent activation of CMV. We can talk a little bit. What is CMV? Where does that come from? And then you had me run all these really crazy antibody tests. And I'm like, never heard of these, but we're going to do it, and they all came back super elevated. But here, this is a, he's a younger guy, in his 30s, but like I said, not maybe super healthy because he's a smoker, but he doesn't, drink, and he has a relatively healthy diet, those kinds of things. And then we talk about your son, which I want to hear about, who is a young, fit bodybuilder, like you've been
football player, Texas Tech, right? All that.
So that's a big misinformation that it's just the unhealthy people. It's really not. It could be anybody.
I think it's more striking in the people that have, relatively good health. They look great. And, it's like, wow, why is this happening to me? I'm fit, I'm healthy, I got a lifestyle that's really good for me, and yet I'm experiencing symptoms, and I know, whether it's teaching at A4M or, having groups with my doctors, my medical docs, we try to approach it as a team approach that says, hey, what are we going to do about trying to manage this? Because I'll give a good example. My son, for example, he got COVID really bad when he was playing football at Texas Tech. I mean, he felt terrible. Not bad enough where it's like, oh my gosh, we're going to have to, send you to the hospital. I think at that time, probably good.
Yep.
But, 14 days out, what's the recommendation? You test negative, you're all clear.
Right.
Get back on the football field, you can play. Back to those 14-hour days. And then got it a second time. Didn't feel too good after that, but it wasn't as severe. But what they're finding is that sometimes these symptoms of long haul is just like what you said about, your son-in-law was, it's 2 or 3 years later that things start popping up. And in my son's case, he started having these strange, palpitations, almost the feeling of, arrhythmias, really scaring him. I mean, this is a, husky weightlifting, masters in human performance guy, right? He's living the lifestyle of good health. And he was generally and genuinely feeling like, oh my God, there's something wrong with my heart. I mean, now, what am I going to do? And so we got him into the cardiologist, ran all the traditional tests, and nothing really came up that was significant that the cardiologist said, hey, you know what? Get the caffeine down. You know, if you're using the Zen pouches, don't do those.
The usual things that we know what to say.
Yeah, right.
No explanation.
Yeah, no, but really try doing that. Got a little bit of resolution, but the symptoms just kept coming back. And we, obviously ran all these advanced panels on him and looked at his spike proteins, which you can get that lab at a traditional lab.
Yep, that's what I got on my patient.
Did that. And there it was. He had a lot of what we call zombie cells or cells that were triggering a lot of inflammatory signaling. He had high spike proteins. And so, we had to take another approach to get him to feel better. And it was complicated in his case because he had also, 2 years of his college career, he had lived in a very moldy old house. So he had layers to why this seemingly healthy person all of a sudden was really in fear of, am I going to be like this the rest of my life as a 25-year-old, afraid to get my heart rate up because I'm working out, afraid that I'm going to have a drink as alcohol would trigger it. So if he had more than a single drink, he would start to notice these palpitations coming on. And I have to say that, fortunately, asking especially, I think what I do is I collect information from a lot of folks and I happen to be able to process it and put it together. Well, we put together a plan for him and you know what, he's feeling a lot better these days. But we've all got multiple cases of this. I was telling you about that case of, woman comes to me perfectly healthy, 53 years old, doing the traditional things that we do, right? Hey, my docs are optimizing her hormones and we're working with her stress response, improving diet. 6 months later, she comes in and she's got prediabetes numbers.
Wow.
And I was like, why? Well, I did get COVID again. And then I said, well, that's odd. I typed in COVID long haulers and insulin resistance and development of diabetes just to do a quick literature search. And there it is in the literature.
Wow.
So.
Wow. Well, wow. Okay. So we've got a weird opportunistic infection, another weird opportunistic inflammatory response. So and I want to talk about spike proteins because I want people to understand what that means and why it's important to look at that. And then you've got this other person who's, and I told you about a woman I met, really amazing, healthy young lady who developed full-blown pancreatic, shut down type 1 diabetes a couple of weeks after an infection. And why is this happening? Is it just simply that we're, our bodies are fighting things constantly every day. So does it just dampen the immune response in such a way that all these opportunistic viruses that normally wouldn't affect us? Like, explain kind of how it happens, and then let's talk about the spike protein, because I think that's important to understand. Why would you test for that?
Yeah, so I mean, the spike protein is obviously when you get COVID, the virus basically drills a spike into the cell, and furin is what kind of activates that. And it really isn't that it inactivates your immune system, it's turbocharging it. So there is a component to the complication of, well, because some people would develop clots, more risk for, throwing a clot. Well, do you have genetics that show that like D-dimer is going to go up on you, which is a marker for, increased risk of that. And then, but the reality is that the more compromised you were going into getting the exposure, it's true if you were diabetic or you were pre-diabetic or you had heart disease or, your immune system was compromised, you didn't have the resiliency in your cell that when that virus, got in there, that you depleted your NAD levels really quick. And so NAD is what's needed for the mitochondria so that you generate energy. And so when those levels are low, now I don't have the ability to fight. And what that did was triggered a cytokine storm. So so what happened is you actually triggered all the inflammatory side of your immune system to activate in order to try and accommodate for the fact that, hey, we're in trouble, we're getting attacked here. But the problem is the immune system stayed turned on. So the active infection goes away. You've got the spike proteins that are kind of still present, triggering all this. And then you've got an immune system that is still releasing all these inflammatory compounds. And that's kind of consistent with that metaflammation model where your body gets a vector. It turns on the inflammatory response in order to get that vector, that bug, to get out of the way, knock it out. And then your body's supposed to go back to not having that inflammation response. So instead what's happening is you're a raging fire of inflammation that eventually over a period of time, depending on where maybe where your weakness might be, or just particular to where those tissues got more particularly affected. Now you come up a year later, 2 years later, 2 weeks later, like what you said, there's a problem. Now all of a sudden symptoms start to show up. And it's interesting because I really think, and I've talked to, a lot of medical docs that are, in this space, that they say a lot of times when you run against those viral titers, that it may be that the immune system is just so charged up that you're, when you do the antigen test, you're just reacting to all those. And it may just be that immune system is so, now in the case of an IgM response, a little bit different, but that may be the source cause. So the spike proteins are the result of not being able to clear what's going on. Still present, still activating these downstream metabolites of inflammatory markers, or what's known as zombie cells that can't stop making inflammatory compounds that are being released out into your tissues. That's usually happening when you get to my age. They start talking about zombie cells happening when you get into your 60s. But now it's happening in people
young
in their 20s and 30s because, the lingering effect or the long haul COVID effect.
Wow. Okay, so that's a lot. So question about the spike protein though, would everybody that ever had COVID, no matter how long ago, be positive for those spike proteins, or do long haulers have higher numbers or higher levels? Yeah,
sure. I mean, I would say you have to go across a big population of people to answer that question, but I think you've got long haulers that have the inability for some reason to clear that infection, still have higher levels. They're still experiencing it.
Got it.
I got COVID twice. I'm not having brain fog. I'm not having fatigue. I'm not having any issues. So I think I was fortunate in that cleared it. At the same time, there's a lot of people, I think a big population of people, where they're having some sort of lingering symptoms that are occurring.
Wow. Okay. So if you were going to break it down in a very bite-sized pieces. The overarching issue that's happening is essentially the body is not able to turn off that inflammatory response or that immune response.
Right.
And it seems like there's the opportunistic piece of it. It's almost like there's some sort of things are layering and they're layering and they're layering, and it could be inflammation from smoking. It could be getting knocked around on the football field too much. It could be whatever it is, but then there's this one little thing that just tips you over, and then here we go.
I think that's exactly it. I mean, people always like to say, get to the root cause. I always express, get to the root causes. Because,
Yes.
I'm not eating right. I'm not getting enough sleep. I'm under a lot of stress. We just had a newborn at home. I'm waking up every 2 hours.
Right.
Oh, and then, I've gained weight, right? You have all these things that line up, and then you get exposed. And look, that can happen kind of with anything, can take you over that tipping point, or, the proverbial
Right.
straw that breaks the camel's back. I just think that we had a particularly nasty virus that really was opportunistic, had the ability to get into your cells and then trigger that chronic inflammation response. And of course, with that inflammation response in the cell, you lose that mitochondrial capacity, because there's a lot of research saying it's all about the fact that the mitochondria are damaged. Well,
It's partly.
yeah, it's true, but it's a part of that equation that is, what's got, pushing people down that path of having symptoms.
So there's so many ways we can talk about this, and we'll probably do some more on it, obviously. But before we talk about, maybe what some people could do, there's also a big uptick in cancers, particularly since 2020.
Right.
And particularly in young people and relatively healthy people. And I've seen some of the literature pointing to that. Obviously, cancer is an opportunistic disease, right?
Right.
We're constantly fighting. Our bodies are fighting all the toxins that either we breathe in, we put on our body, we take in with food, whatever it is. But talk a little bit about that, about what you're seeing and what we're seeing in that space with all these upticks of all kinds of cancers, not even a particular one, and understanding cancer as really an opportunistic disease and how it relates to this.
Yeah, and I'll go back. I'm big on searching, as you know,
Yeah.
when I do a lecture, I've always
Yep,
got a lot of
same.
references on
Right.
every slide, because
Yeah.
I don't want to be accused of, this is my opinion.
That's right.
And I would say another area that's in the literature is exactly what you said, that there seems to be a correlation of, hey, if you had COVID, and that there's this correlation that cancer is in that potential pathway for the future. But that makes sense to me. Because one, we already know, that viruses can trigger some
Sure.
sorts of cancer.
Cancers, that's
that's
right.
been well known for a long time now, right? A couple decades.
Right.
But then when you understand that, how do cancer cells actually become cancer cells? Cancer cells actually start to grow or become a cancer cell because the internal environment of the cell, there's no longer proper use of energy in the cell, which is, once again, go back to the powerhouse of the
Yep,
cell, the mitochondria. And what that does is that you start to create a lot more pollutants within the cell. So I
Right.
get damage to my cell, I get more pollutants. And for those people that may be more susceptible, who knows all the predisposing
Right.
risk factors that are in there, familial, all that stuff. But in the end, the Warburg effect, which is known as how cancer cells make energy,
Yep.
the Warburg effect starts to happen, where now the cell can live in a highly polluted environment, meaning a high lactic acid environment. And that induces the ability of that immortal cell. And it takes those pollutants, that lactic acid, and pumps them out outside the cell. And that allows to erode kind of the area around the cell, so that as the cells duplicate, there's room.
Yeah.
And so I'm not surprised that when you turn the immune system on and you activate all of this inflammation signaling, that in the end, your cells become compromised.
Right.
And when they become compromised, the end of that train, right, the end of that flow, it's called de-differentiation of the cell. Your cells just de-differentiates and blows up.
Yep.
But that's what happens. People with diabetes are kind of on that journey already, right? They already have kind of poor mitochondrial function.
Right.
And they're more at risk for cancer. So you can think of, if I'm a pre-diabetic or my blood sugars aren't controlled well, and then I get COVID, I could accelerate myself into that situation.
Yeah. And, the same thing I would imagine if you have, we're probably going to do a whole conversation around the gut in this conversation because a whole show about it, but because that gut dysbiosis, which we've talked about before, is that bad bacteria overgrowth, releasing those little lipopolysaccharides out into the system, which increase this, your whole body inflammatory response. And you said the Warburg effect, and, a lot of people don't understand that, that cancer cells divide and thrive differently than healthy cells through fermentation, which has to do with sugar, glucose, rather than obviously oxygen like healthy cells. So there's a connection with diet there. You can just create the perfect storm. You've had COVID, you've got this hyperactive immune response, you've got baseline inflammation, and now you bring in the standard American diet that is highly processed, high sugar. I mean, it's just the perfect storm, for cancer. And so, diet has to be a part of the conversation of, well, how do I treat and how do I prevent, which I think we can get into that a little bit. But that might be a whole next show. Wow. That might be part 2, because I think we could talk for 30 minutes on, layering this, how to treat, how to prevent, number one, like for instance, I got sick with COVID a couple of times. I thankfully never got really sick, but it was just tired and I couldn't smell and taste. And so I was like, oh, I guess I have COVID. The biggest thing is I could go home and take a nap in the middle of the day, and that is just not me. But, just working alongside all these years and understanding, supporting your body's inflammation and inflammatory response with certain things that and diet and hormones, of course, it's so important. At first in 2021, when these studies were coming out about postmenopausal women on estrogen weren't dying of COVID, right? That makes sense when we know estrogen's an immunomodulator and it's powerfully anti-inflammatory. Same with testosterone in men, which is an interesting conversation as well. But diet's a huge part of it, and I think prevention. You said this too. Like, you've been sick with COVID a few times. Thankfully, you're not having a lot of these symptoms.
Not having any.
But we're shoving things. We're chewing lipotabs. We're doing green tea extract. We're doing all this stuff all the time. I think we should probably save that conversation for treatment to the next one.
Sure. And
let's just have that conversation. But I want to talk a little bit more. We've talked about just the vagueness, diabetes, and accelerating that and accelerating the opportunistic aspect of cancer growth. And you touched on the heart, and I know we're going to have a longer conversation about the heart. But what is happening, and this can be just kind of maybe the start of this conversation, but explain what is happening with these COVID long haulers and this uptick in cardiovascular disease and heart attacks.
Yeah, so the number one symptom that you're seeing in younger adults is atrial fibrillation. And then if you look at that, so one of the early reports were people would get POTS-like syndrome, right?
Yeah, and to explain what is POTS.
So postural orthostatic tachycardic syndrome, right? So basically your brain, your nervous system isn't telling your heart how to beat correctly. So you lose rhythm. So there's this thought of the autonomic nervous system, central nervous system, getting disturbed by the fact that there's this intense inflammatory signaling going on. And remember, I'm glad you brought up the gut, because there's a nervous system that connects the gut to the brain. Mm-hmm. And early on, what they found out is that COVID would get into the gut and really create a tremendous amount of dysbiosis. Mm-hmm. And they were finding it in fecal samples.
Right. Yep.
Right?
I remember that.
And so, when you alter that enteric nervous system signaling, and they've pointed to this once again, I can't make this stuff up.
Yeah.
It's in the it's in the papers that I pull and I read that, wow, we have this disturbance in the nervous system. The blood-brain barrier gets more leaky because of the lipopolysaccharide.
Leaky brain.
And we alter nervous system conduction. So that's one side of it. More arrhythmias, more tachycardias, more unexplained atrial fibrillation. And then there's the issue of when you trigger inflammation signaling, you're making more inflammatory compounds. You damage the inner lining of the arteries. Mm-hmm. That's called the glycocalyx. So it becomes damaged. And then in addition to that damage, you start to make more bad actor lipids. So whether it's apolipoprotein B or lipoprotein little a, these are little fractions of cholesterol.
That most clinicians don't test for, by the way. So we're going to tell people what to tell your practitioner to test for, but keep going.
Yeah, so there are these little bad actor fractions that actually increase your risk of mortality, or increase your risk of adverse cardiovascular events. So when you combine autonomic nervous system dysfunction, which is a big risk factor for an acute myocardial infarction, that's the biggest risk factor, actually, with lifestyle, with am I exercising or not? When I say lifestyle, what's my diet? What's my exercise? Do I have sleep apnea? These are biggies. Where's my hormones at? Right. My gosh, sex hormones for a healthy heart. You could go on for days on that. I've listened to you. And so you combine that, and then you get the infection. Now all of a sudden you're running down the path of creating these cardiometabolic risks, whether it's bad actor lipids, that nervous system desynchronized, so the heart-brain synchrony that's supposed to take place, it gets disrupted. And now out of nowhere, all of a sudden, like in my son's case, he would freak out. It's like my heart's running wild out of nowhere, and I'm feeling this discomfort. What is this? Am I having a heart attack? Every time it would happen.
Yep.
Right? And so it's that combination of a direct effect, well-established direct effect on POTS-like syndrome. And what that basically is you go to get up from your chair, or maybe you're even on a ladder and you look up, and your nervous system can't accommodate the changes in position, and you can literally pass out.
Yeah. Makes you really dizzy.
Yeah. At the very minimum, you're going to get really dizzy. Yeah. Things are going to get a little black and maybe a little starry-eyed, or you could even pass out.
Yeah.
And so I think that's been really striking that, people don't realize that, when you hear the word nervous system, people go, well, I'm not anxious.
Yeah, exactly.
It's like, I don't need Xanax.
Yeah.
It's not about that.
Yeah.
It's, where's your resting heart rate at? What's your 2-minute heart rate recovery? Do you have heart rate variability measurements to find out, am I healthy? Because remember, everybody knew when they got COVID, because everybody started paying attention to two things: oxygen saturation and their heart rate.
Yep.
Nervous system.
Right.
It wasn't, because oxygen saturation is how well am I perfusing my oxygen into my tissues? Yep. Well, guess what? If your heart rate's going up, that means your blood vessels are getting smaller. Just because of sympathetic dominance, And I had this talk yesterday with a leading sports performance researcher yesterday, because he's measuring those kind of things.
Right.
And we don't tie it all together for people.
Right. It's so complex. It's so complex, but so important for people to understand this, because we're going to keep seeing it more and more. COVID's not going away.
Right.
And we're seeing this big spike in all of these issues, 2 to 3 years after the initial, kind of pandemic happened. We don't have time to talk about how to treat, how to prevent, but we're going to continue this conversation on the next show because I think it's really important for people to understand. We've talked about so much, the gut and the lipid parameters that need to be looked at, all these different things. So let's break it down in another show and keep this conversation going. So thanks for all your wisdom. I mean, it's always so fun to have these conversations with you, but we're going to continue it on. Part 2 of COVID long haulers and what to do about it is coming.
Exciting.